Masturbation mistakes after 60 can silently harm men's health in ways most never suspect. What shocks me most in my 35 years as a urologist is how these common habits undermine vitality, intimacy, and confidence. I'm Dr. Grace Miller, board certified in men's sexual health, and I've helped thousands reclaim pleasure they thought was lost forever. Mistake number one: believing masturbation becomes less important with age. Many men over 60 assume self-pleasure is something they should naturally outgrow, or that it serves no purpose in their stage of life. This misconception is both widespread and deeply harmful to overall health. I frequently see patients who quietly stopped all forms of self-stimulation after retirement, believing it was no longer necessary or appropriate. One gentleman in his late 60s confessed he hadn't touched himself intimately in nearly 4 years, assuming this was the natural course of aging. What he didn't realize was how this decision was affecting his entire body. From a medical perspective, regular sexual activity, including masturbation, plays a crucial role in maintaining hormonal balance. Studies consistently show that sexual stimulation in older men helps maintain testosterone levels, supports prostate health, and preserves neural pathways associated with pleasure. The use it or lose it principle applies quite literally to sexual function. When men abandon self-pleasure, the physical consequences accumulate silently. Blood flow to genital tissues diminishes, leading to atrophy of erectile tissues and decreased sensitivity. The prostate receives less circulation and drainage, potentially increasing inflammation risk. Even pelvic floor muscles weaken without the regular contractions that come with arousal and climax. Beyond physical changes, the emotional impact can be equally devastating. Men report a growing disconnection from their bodies, decreased confidence in intimate situations, and a sense of resignation about their sexuality. Many begin to see themselves as past their prime, reinforcing negative age stereotypes that science simply doesn't support. The solution isn't complicated, but it requires a mental shift. Recognizing that self-pleasure remains a valid, healthy practice throughout life is the first step. Establishing a regular, intentional routine, even just once or twice weekly, helps maintain tissue health, hormonal function, and neurological pathways. Think of it as maintenance, not indulgence. This misconception about age and sexual necessity often leads directly to our next crucial mistake: using techniques that no longer serve your changing body. Let's explore why the approaches that worked in your 30s might be silently sabotaging your experience now. Have you ever noticed that a favorite meal eaten the same way for years gradually loses its flavor? Your body's response to pleasure works the same way. The second critical mistake many men over 60 make is relying on the exact same self-stimulation techniques they've used since early adulthood, despite significant changes in their physiology. Research from the Journal of Sexual Medicine reveals that nearly 78% of men over 65 report using identical masturbation patterns throughout their adult lives. Yet these men also reported the highest rates of dissatisfaction and diminishing returns. This disconnect reveals an important truth. What worked at 30 rarely works the same way at 70. Why does this happen? The science is fascinating. Your nervous system naturally adapts to repeated stimulation through a process called habituation. When you use the same grip, pressure, speed, and motion for decades, your nerve endings become less responsive to that specific pattern. It's not that sensitivity is lost entirely. Rather, it's been trained to require more intensity from that particular technique. Additionally, the skin and underlying tissues change with age. Collagen and elastin fibers decrease by approximately 1 to 2% annually after 40, resulting in thinner, less resilient skin with fewer nerve endings per square inch. These physiological changes mean your body simply cannot respond to stimulation the same way it once did. The physical consequences extend beyond momentary frustration. Many of my patients report a progressive decline in sensation, requiring increasingly vigorous stimulation that can actually damage delicate tissues. Some develop a form of conditioned response that makes partnered intimacy difficult or unsatisfying because the sensations differ from their habitual pattern. Emotionally, this situation creates a troubling cycle. Men experience growing frustration when reliable techniques no longer deliver expected results. This leads to questioning their virility, sexual capacity, or whether something is broken. Many silently wonder if sexual pleasure is simply over for them, a devastatingly incorrect conclusion. The solution requires curiosity and adaptation. Experiment with varying pressure, rhythm, and technique. Try using your non-dominant hand, which creates new neural pathways. Incorporate different positions, temperatures, warm or cool sensations, or tactile elements. Quality lubricants, which we'll discuss later, can transform sensitivity in aging skin. The goal isn't to abandon what works entirely, but to expand your repertoire and retrain your nervous system to respond to a broader range of stimuli. While technique matters significantly, an even more common mistake undermines satisfaction for nearly every man I counsel. It's something so ingrained in male sexual behavior that most don't even recognize it as a problem. Rushing through the experience without giving your body the time it actually needs. When was the last time you truly took your time during self-pleasure? Our third critical mistake involves the lifelong habit of rushing toward climax, a pattern that becomes increasingly problematic after 60. A national survey of sexual habits revealed that men over 60 spend an average of just 4.3 minutes on self-stimulation, nearly identical to the time spent in their 20s despite dramatically different physical needs. The origins of this rushed approach are understandable. Many men developed masturbation habits during adolescence or young adulthood when privacy was limited, creating a pattern of efficiency that became deeply ingrained. What began as necessity evolved into an unconscious habit that persisted for decades. From a physiological perspective, this rushed approach becomes increasingly counterproductive with age. Medical research demonstrates that arousal patterns change significantly in older men. Blood flow increases more gradually, requiring 3 to 4 times longer to reach optimal engorgement compared to younger years. Nerve sensitivity follows a similar pattern, with peak response occurring after sustained, gradually increasing stimulation rather than immediate intense sensation. Consider how your cardiovascular system has changed. Would you sprint up several flights of stairs without warming up first? Yet many men approach sexual stimulation with exactly this mindset, expecting their bodies to respond instantly despite physiological changes that make this increasingly unlikely. The physical consequences of rushing extend beyond momentary disappointment. When men consistently cut short the arousal process, they experience only a fraction of potential sensation. Erectile tissues never reach full capacity, nerve endings remain understimulated, and the release of beneficial hormones like oxytocin and endorphins is significantly reduced. One study found that men who extended self-pleasure sessions by just 10 minutes reported up to 60% greater satisfaction and stronger physiological responses. Emotionally, this hurried approach creates a troubling disconnect between mind and body. My patients frequently describe feeling like spectators rather than participants in their own pleasure. Many report a mechanical, goal-oriented mindset that focuses exclusively on completion rather than enjoyment. This mindset reinforces the misconception that sexual function is diminishing, when in reality, it's simply changing in its timing and response patterns. The solution requires a fundamental shift in approach. Mindfulness techniques, focusing completely on physical sensations without judgment, can transform the experience. Set aside dedicated time without distractions. Begin with gentle touch to non-genital areas, allowing arousal to build gradually. Use conscious breathing to enhance blood flow and sensation. Experiment with pausing when arousal builds, then resuming, a technique called edging that significantly enhances both pleasure and physiological benefits. This rushed approach often means overlooking something crucial to satisfaction after 60: the importance of whole body pleasure. When we focus exclusively on genital stimulation, we miss the rich landscape of sensation that becomes increasingly important as we age. Where does pleasure begin and end in your body? This question often surprises my patients who've spent decades thinking of sexual pleasure as confined to one central area. Our fourth critical mistake is narrowing focus to genital stimulation alone, ignoring the rich landscape of sensation available throughout the entire body. In my 3 decades of specialized practice, I've documented a fascinating pattern. Men who report the highest satisfaction after 60 are consistently those who incorporate full body awareness into their self-pleasure routine. Conversely, those limiting stimulation to genital touch alone report the steepest decline in satisfaction as they age. The scientific explanation involves a physiological phenomenon rarely discussed in men's health: age-related redistribution of erogenous sensitivity. Studies using advanced sensory mapping technology have documented that while genital sensitivity may somewhat decrease with age, sensitivity often increases in other areas: inner thighs, lower abdomen, chest, neck, and especially the perineum. This redistribution isn't a deficit, but an evolution, offering new pathways to pleasure that many men never explore. A comprehensive study in the Journal of Sexual Medicine found that men over 65 who incorporated whole body stimulation reported satisfaction levels matching those of men decades younger. The researchers concluded that age-related changes in sexual response may be significantly offset by adapting techniques to engage these expanded erogenous zones. Physical consequences of ignoring this whole body potential are significant. Circulation patterns change with age, with blood flow becoming more distributed across the body rather than heavily concentrated in genital tissues. By ignoring this physiological shift, men miss the opportunity to activate neural pathways that enhance overall arousal. The prostate, increasingly important for pleasure after 60, is indirectly stimulated through areas like the perineum. Yet this connection remains underutilized by most men. Emotionally, the impact extends beyond physical sensation. A one-dimensional approach creates a narrow definition of what constitutes success in sexual experience. When pleasure is defined solely by genital response, natural age-related changes can feel like failure rather than adaptation. Many men report a growing sense of disconnect from their bodies when focusing exclusively on performance rather than comprehensive sensation. The solution requires exploration and curiosity. Begin by incorporating gentle touch to non-genital areas during self-pleasure: inner thighs, abdomen, chest, and neck. Pay particular attention to the perineum, the area between scrotum and anus, which contains dense nerve clusters connected to the prostate. Experiment with varying pressure, from feather-light to firm. Temperature variations through warm towels or cool materials can awaken new sensations. Most importantly, approach this exploration with patience. New neural pathways take time to develop. Even with whole body awareness, many men overlook another crucial element that becomes increasingly important after 60: proper lubrication. The changes in skin elasticity, moisture, and sensitivity that occur with age make this next mistake particularly problematic for aging tissue. Mistake number 5 reveals a striking contradiction in men's health practices. While approximately 87% of men over 60 use moisturizers for their face and hands, fewer than 15% use appropriate lubrication during self-stimulation. This oversight occurs precisely when aging skin requires more moisture, not less. The reluctance to incorporate lubrication stems from several misconceptions. Many men consider it unnecessary, associating lubricants with female sexuality or medical dysfunction rather than enhanced pleasure. Others view it as an admission that something is wrong, rather than recognizing it as a proactive adaptation to natural physiological changes. The scientific reality is compelling. After age 60, the skin undergoes significant structural changes, including a 50–60% reduction in sebaceous gland activity, which dramatically decreases natural lubrication. Collagen and elastin fibers diminish by approximately 1–2% annually, leading to thinner, less resilient skin. Hydration capacity decreases by up to 30%, making tissue more vulnerable to friction. These changes affect the entire body, but are particularly significant in sensitive genital tissues. Dermatological studies have documented that continued friction on aging skin without adequate lubrication creates a cascade of negative effects. Microscopic tears develop in the skin's outer layers, creating vulnerability to inflammation and infection. These tears, though invisible, trigger pain receptors and protective mechanisms that actually reduce sensitivity over time. Blood vessels near the surface become more fragile, leading to bruising or discoloration with repeated friction. The consequent physical discomfort transforms what should be pleasurable into something potentially painful. Inflammation from friction can persist for days, creating a cycle where men begin to associate self-pleasure with discomfort rather than satisfaction. More concerning, frequent microtears in sensitive tissue can lead to fibrosis, the development of less sensitive scar tissue that permanently reduces sensation. The emotional impact extends beyond physical discomfort. Men frequently report frustration and confusion when previously pleasurable touch becomes uncomfortable. Many wrongly attribute this change to an inevitable loss of sexual function rather than a simple mechanical issue with a straightforward solution. Some gradually reduce frequency or abandon self-pleasure entirely, unnecessarily sacrificing an important aspect of health and well-being. The solution is remarkably simple yet transformative. Water-based lubricants are specifically formulated for sensitive skin, providing immediate relief from friction while preserving tissue health. Silicone-based options offer longer-lasting protection for extended sessions. Plant-based formulations with aloe vera or hyaluronic acid actually support skin health while enhancing sensation. The key is choosing products free from glycerin, parabens, and artificial fragrances, which can irritate sensitive skin. Many patients report that proper lubrication doesn't just prevent discomfort, it actually restores sensations they thought were permanently diminished. The initial application should be generous, with small amounts added as needed, rather than waiting until dryness occurs. This proactive approach protects tissue integrity while enhancing pleasure. Physical comfort is critical, but the next mistake moves beyond the body into the psychological dimension. Even with proper technique and tools, many men unknowingly sabotage their experience through a burden they've carried silently for decades: shame about self-pleasure that no longer serves them. The psychological weight of shame may be the most invisible yet damaging mistake affecting men's sexual health after 60. According to a recent survey in the Journal of Sexual Medicine, over 65% of men report experiencing guilt or shame about self-pleasure, with the highest percentages occurring in men over 60. These feelings persist despite decades of adult independence, suggesting that early messaging about sexuality can remain remarkably persistent throughout life. These psychological barriers often emerge during confidential health assessments. Men from diverse backgrounds, religions, and education levels describe similar patterns: intellectual understanding that self-pleasure is normal, yet persistent emotional discomfort that they cannot seem to shake. Some report feeling they should have outgrown the need for sexual pleasure, reflecting internalized ageism rather than physiological reality. The scientific impact of this shame creates a direct biological obstacle to pleasure. When experiencing guilt or shame, the body activates the sympathetic nervous system, our fight or flight response, releasing cortisol and adrenaline that directly interfere with sexual function. These stress hormones constrict blood vessels, reduce sensitivity, and redirect energy away from non-essential functions, including arousal and pleasure. Brain imaging studies show that regions associated with pleasure become less active when shame is present, while regions associated with self-criticism become hyperactive. The physical consequences manifest as tension patterns that can be measured and observed. Muscle groups, particularly in the pelvic floor, lower abdomen, and inner thighs, remain contracted rather than relaxed. This persistent tension restricts blood flow to genital tissues, limits nerve response, and prevents the natural rhythmic muscular contractions essential for full arousal and satisfaction. Studies utilizing biofeedback sensors document that men experiencing shame during sexual activity show up to 40% less genital blood flow and significantly reduced ability to release muscle tension. Emotionally, this conflict creates a distressing cycle where moments that should provide pleasure become sources of stress. Many men report a pattern of anticipation, followed by activity, followed by self-criticism or regret, a cycle that reinforces negative associations rather than positive ones. Some describe feeling split between physical pleasure and mental discomfort, never fully present in the experience. This disconnection often extends beyond self-pleasure to impact partnered intimacy as well. The solution begins with conscious recognition and reframing. Modern medical science unequivocally confirms that regular sexual activity, including masturbation, remains beneficial throughout life. Regular ejaculation is associated with reduced prostate cancer risk, improved sleep quality, natural pain relief, immune system regulation, and stress reduction. Far from being something to overcome, self-pleasure represents an important form of self-care and health maintenance. Practical steps include deliberate language shifts, replacing judgmental terms with neutral or positive ones. Medical terminology can help create emotional distance for some men, while others benefit from explicitly positive language that affirms the value of pleasure. Creating deliberate, private rituals around the experience can shift it from something hasty or hidden to something intentional and affirming. Some men find that integrating mindfulness practices helps maintain present moment awareness rather than falling into patterns of self-judgment. While mindset matters greatly, another limitation comes from failing to adapt to specific health conditions that naturally emerge with age. Many men become frustrated when they don't understand how common health issues directly impact their sexual response, and how simple adjustments can compensate for these changes. Did you know that over 80% of men over 60 have at least one chronic health condition, yet fewer than 30% understand how these conditions directly affect their sexual response? This disconnect represents our seventh critical mistake: failing to adapt self-pleasure techniques to accommodate specific health conditions. Chronic conditions create distinct patterns in sexual function that I observe consistently in clinical practice. Men with cardiovascular issues often report sudden decreases in sensation and satisfaction, while those with diabetes frequently describe a gradual decline in sensitivity that seems mysterious and frustrating. Patients with arthritis or joint conditions struggle with positions and techniques that once worked easily, while those taking multiple medications notice timing and intensity changes they can't explain. The scientific mechanisms behind these changes are well documented, but rarely discussed in routine medical appointments. Cardiovascular conditions reduce microcirculation to sensitive tissues, with studies showing up to 60% decreased blood flow to genital regions even when other body systems receive adequate circulation. Diabetes damages the delicate nerve endings responsible for pleasure through a process called peripheral neuropathy, affecting up to 70% of long-term diabetics. Musculoskeletal conditions limit range of motion and endurance, while common medications for hypertension, depression, and cholesterol management directly impact arousal mechanisms. A comprehensive review in urology found that each 10 mmHg increase in certain blood pressure medications correlates with measurable changes in arousal response. Similarly, statin medications, while critical for heart health, alter testosterone pathways in ways that can affect both desire and physical response. Even over-the-counter anti-inflammatory medications temporarily reduce sensitivity by blocking prostaglandins involved in sensation. The physical consequences extend beyond the immediate experience. When health conditions remain unaddressed, men often compensate with increased pressure or friction, potentially damaging tissues already compromised by reduced circulation or sensation. This creates a counterproductive cycle where more vigorous stimulation causes inflammation, which further reduces pleasure, leading to even more aggressive techniques. The emotional impact often manifests as profound frustration and confusion. Men report feeling betrayed by their bodies or believing they've suddenly accelerated into advanced age when the actual issue is a specific, addressable health factor. Many begin avoiding self-pleasure entirely, incorrectly concluding that sexual function has ended rather than evolved. This withdrawal often correlates with measurable increases in depression and anxiety scores, creating another cycle that further impacts both physical and emotional health. The solution requires condition-specific adaptations backed by medical research. For cardiovascular conditions, scheduling self-pleasure when circulation is naturally optimized, typically morning for most men, can improve response by up to 40%. For diabetes, specialized lubricants with gentle warming properties can help compensate for reduced sensation. Those with arthritis benefit from ergonomic approaches and supportive positioning. Men taking medications should time self-pleasure based on their medication's peak efficacy and lowest side effect windows. Most importantly, these adaptations should be discussed openly with healthcare providers. Research shows that men who directly address sexual health concerns with their doctors have significantly better outcomes and satisfaction. Many medications have alternative options with fewer sexual side effects, and many conditions have specialized treatments that specifically preserve sexual function when this priority is made clear to healthcare teams. Speaking of adaptations, the next mistake involves a common resistance that unnecessarily limits pleasure and comfort for countless men: the reluctance to incorporate helpful tools specifically designed for aging bodies. Consider this paradox. We readily accept reading glasses to compensate for presbyopia, hearing aids to address auditory changes, and joint braces to support aging knees. Yet when it comes to sexual wellness, many men resist using tools designed specifically for their changing bodies. This resistance represents our eighth critical mistake: avoiding aids and enhancements that could significantly improve comfort, pleasure, and satisfaction. A recent survey of sexual health in older adults revealed a striking discrepancy. While 78% of men over 60 report some physical limitation affecting self-pleasure, joint pain, reduced grip strength, positioning difficulties, only 12% had considered using any form of assistive device. When asked why, responses clustered around themes of pride, uncertainty about options, or concerns about seeming dependent on artificial aids. Current medical understanding of aging physiology strongly supports the use of appropriate tools. The same ergonomic principles that inform occupational therapy and physical rehabilitation apply directly to sexual wellness. Research demonstrates that properly designed aids reduce joint strain by 40–60%, decrease muscle fatigue during extended activity, and enable more precise stimulation patterns that aging hands may struggle to maintain consistently. The biomechanics are straightforward. Aging bodies experience natural changes in grip strength, decreasing 1–2% annually after 60, joint flexibility, reduced by up to 30% in wrists and fingers, and muscle endurance, declining approximately 5% per decade. Sexual wellness tools specifically address these changes through ergonomic design, providing extended reach, reducing strain on arthritic joints, and maintaining consistent stimulation without requiring sustained grip strength or precise motor control. Without appropriate aids, the physical consequences accumulate gradually. Many men report abandoning positions or techniques they once enjoyed due to discomfort rather than preference. Extended sessions become increasingly difficult, with joint pain often interrupting arousal before satisfaction is achieved. Circulation issues in the hands, common after 60, can lead to numbness or reduced dexterity during crucial moments. These limitations create unnecessary barriers to an experience that should remain comfortable and accessible throughout life. The emotional impact often manifests as a sense of progressive loss rather than adaptation. Men describe feeling betrayed by bodies that no longer respond to familiar approaches, leading to frustration and sometimes resignation. Many interpret these physical limitations as evidence of irreversible decline rather than recognizing them as challenges with practical solutions. This mindset creates a negative feedback loop where each difficult experience reinforces the belief that sexual pleasure is inevitably diminishing. The solution involves reconceptualizing these tools as extensions of natural ability rather than replacements for it. Modern designs prioritize dignity, discretion, and effectiveness without medicalization. Ergonomic handles provide extended reach and reduced joint stress. Textured surfaces compensate for decreased finger sensitivity. Variable settings allow personalization to changing needs. Warming features address circulation issues. Each of these innovations serves a specific physiological purpose rather than merely adding novelty. When introduced to appropriate options, many men express surprise at both the sophistication of current designs and their effectiveness. The initial hesitation typically dissolves when tools are presented as practical adaptations similar to other modifications made for aging bodies, like ergonomic kitchen tools, supportive footwear, or reading accessories. This framing removes stigma and emphasizes continuity of function rather than loss. Tools help physically, but the next mistake involves something deeper: the communication gap that prevents many men from receiving appropriate guidance and support for their changing sexual health needs. This silence between men and their healthcare providers creates unnecessary isolation during a time when professional insight could make a profound difference. The communication gap between men and their doctors represents one of the most costly missed opportunities in aging men's health. A national healthcare survey revealed that while 68% of men over 60 have concerns about their sexual function, only 17% have ever discussed these issues with a healthcare provider. This silence carries a steep price in quality of life and missed solutions. During specialized health assessments, a troubling pattern emerges. The majority of men experiencing significant sexual changes wait an average of 2 to 3 years before seeking help, with some enduring difficulties for a decade or more. By the time many reach a specialist's office, they've often developed compensatory habits or complications that could have been prevented with earlier intervention. The scientific rationale for professional consultation is compelling. Sexual function involves complex interactions between vascular, neurological, hormonal, and psychological systems, all of which are affected by common age-related conditions and medications. For example, the standard dosing protocol for many blood pressure medications can reduce sexual response by 30–40%. Yet simple adjustments in timing or alternative formulations can often minimize these effects without compromising cardiac health. Research in pharmacology demonstrates that nearly 60% of medications commonly prescribed to men over 60 have potential sexual side effects, yet fewer than 25% of these effects are discussed during prescription consultations. Clinical studies consistently show that when men report these concerns, alternative treatments with comparable effectiveness but fewer sexual side effects can be identified in approximately 70% of cases. The physical consequences of this communication gap extend far beyond temporary frustration. Unaddressed concerns often lead to complete abandonment of sexual activity, which research links to accelerated tissue atrophy, reduced pelvic blood flow, and hormonal imbalances that affect overall health. Many treatable conditions, from simple testosterone deficiencies to early-stage circulatory issues, remain undiagnosed because the primary symptom, sexual change, goes unreported. Perhaps more significant is the emotional toll of silent suffering. Men who avoid these discussions report higher rates of depression, relationship strain, and diminished self-concept. Many describe a profound sense of resignation, accepting sexual changes as inevitable rather than potentially addressable. This fatalistic mindset often extends beyond sexuality to affect overall engagement with health maintenance and quality of life. The solution begins with recognizing that healthcare providers are trained to address these concerns professionally and have access to interventions most men never discover independently. Initiating these conversations becomes easier with preparation, writing specific questions beforehand, using medical terminology rather than colloquial language, and framing concerns in terms of function rather than performance. For those uncomfortable with direct discussion, many medical practices now offer preliminary screening questionnaires that include sexual health questions, allowing providers to initiate the conversation. Specialized men's health clinics provide environments specifically designed for these discussions, with providers who have advanced training in age-related sexual health. Research consistently demonstrates that men who engage in open communication with healthcare providers about sexual concerns report significantly higher satisfaction with their overall care and better outcomes across multiple health metrics. This single change, breaking the silence around sexual health, often proves transformative, not just for sexual wellness, but for comprehensive health management. Even with medical support, many men overlook a fundamental principle of physiological maintenance that applies as much to sexual function as to any other bodily system. The consistency with which you engage these systems directly impacts how well they continue to serve you as you age. Our final mistake centers on a fundamental physiological principle that applies to every bodily system, yet is rarely discussed in the context of sexual health. Consistency matters. The irregular, sporadic patterns of sexual activity common among men over 60 directly contradict what research tells us about maintaining tissue health and function as we age. Longitudinal studies tracking sexual wellness across decades reveal a striking pattern. Frequency predicts function. Men who maintain regular sexual activity throughout their 60s, 70s, and beyond consistently report better function, greater satisfaction, and fewer difficulties than those with erratic or infrequent patterns. This finding holds true regardless of relationship status, making it particularly relevant for self-pleasure practices. The underlying physiological mechanism follows the same principles that guide all aspects of physical maintenance. Regular blood flow to genital tissues maintains their elasticity, oxygenation, and neural sensitivity. With each arousal cycle, specialized cells receive signals to maintain their specialized functions rather than atrophy. The corpus cavernosum, the spongy, erectile tissue, requires periodic expansion to preserve its capacity for engorgement, much like how regular movement preserves joint flexibility. Research in tissue physiology demonstrates that prolonged periods without arousal, typically beyond 3 to 4 weeks, trigger measurable changes in both structure and function. Blood vessels begin a process similar to hibernation, reducing their diameter and responsiveness. Nerve endings become less sensitive when unstimulated for extended periods. Even hormone receptors show decreased sensitivity and numbers without regular activation. The physical consequences accumulate gradually but significantly. Men who engage in sexual activity less than monthly show up to 30% reduction in peak blood flow to genital tissues compared to those maintaining weekly patterns. Tissue elasticity decreases by approximately 15 to 20% after 3 months of inactivity. These changes aren't immediately apparent but become increasingly noticeable when activity resumes, creating the impression of sudden decline rather than gradual adaptation to disuse. The emotional impact creates a troubling cycle that research consistently identifies. Initial difficulties following periods of inactivity often lead to decreased confidence, which further reduces frequency. Many men report a pattern where longer intervals between experiences correlate with growing anxiety about performance, creating a self-reinforcing loop where avoidance becomes the default response. This psychological pattern compounds the physical changes, accelerating functional decline far beyond what age alone would cause. The solution is surprisingly straightforward yet transformative: establishing a regular, intentional routine for sexual activity, including self-pleasure. Clinical evidence suggests that weekly engagement provides optimal maintenance benefits, though even bi-weekly patterns show significant protective effects compared to monthly or less frequent activity. Consistency matters more than duration or intensity. Brief, regular sessions maintain tissue health more effectively than occasional extended ones. For men concerned about motivation, framing this practice as health maintenance rather than recreation can be helpful. Just as many maintain exercise routines primarily for health rather than enjoyment, regular sexual activity serves important physiological functions regardless of momentary desire. Scheduling specific times, rather than waiting for spontaneous interest, helps establish sustainable patterns. Many find that desire often follows action rather than preceding it, particularly as routines become established. As we conclude our exploration of these 10 critical mistakes, it's important to recognize the profound connection between sexual wellness and overall vitality in the later decades of life. Each mistake we've discussed, from outdated beliefs about importance, to techniques that no longer serve aging bodies, to rushed experiences, limited focus, inadequate lubrication, persistent shame, ignoring health conditions, avoiding helpful tools, communication gaps with healthcare providers, and inconsistent patterns, represents an opportunity for positive change rather than resignation. The research is clear. Sexual wellness remains an important component of health throughout life. Men who address these common mistakes report not just improved sexual satisfaction, but better sleep, reduced stress, improved mood, and greater overall confidence. These benefits extend far beyond the bedroom, influencing how men engage with all aspects of life after 60. Most importantly, these changes require no extraordinary measures, just accurate information, modest adjustments, and the willingness to evolve rather than abandon practices that contribute significantly to quality of life. The body continues to offer pathways to pleasure and connection at every age when approached with appropriate knowledge and care. Your sexuality doesn't have an expiration date. It evolves, changes, and can even deepen with the wisdom and self-knowledge that comes with age. By addressing these 10 mistakes, you reclaim not just physical pleasure, but a fundamental aspect of human experience that remains your right and privilege throughout all the decades of your life.